Oh, I'm Dr. Tansek, and I do ear, nose, and throat, which is also called otorhinolaryngology, head and neck surgery.
What was Renee's initial diagnosis when you first met her?
She had a nodule in the left lower pole of her thyroid, and we were worried that it might be malignant, and our fine needle biopsies, even though we repeated it, weren't definitive one way or the other.
And what was the course of treatment for her then?
So she ended up having a left hemithyroidectomy. We'd take out half of it, and the frozen sections weren't very definitive either, so we just said, let's wait for the final pathology, which takes about a week. And it turned out to be benign. If it's not benign, you have to go back in and take out the whole thyroid, but that didn't have to be done.
Is there any side effects or anything?
Well, you only need 1 gram of thyroid tissue to have a normal thyroid function, and we checked that, and that was fine. But unfortunately, we're not quite sure why our left vocal cord didn't move.
Is this a common thing that happens when people have
No,
surgery?
it's very uncommon. It happens sometimes, and we don't always know why. Because we could see the nerve, it looked completely intact, and maybe it was from pulling on it because it was stretched around that nodule she had, so maybe just pushing it off to the side so that it could, so we could get the tumor part out, might have stretched it enough so it didn't work. And that can happen because nerves don't like to be stretched either.
And at that time, though, it was pretty definitive. She was not speaking or singing at all.
No, it doesn't work with one vocal cord. You can talk, but you tend to have a whispery voice, and you have to learn to swallow carefully because otherwise it can go down the wrong way, which happened. And even if people say they have a stroke and they lose one vocal cord, usually the better one learns to compensate, so it crosses the midline so that you can get a speaking voice and eat without aspirating.
What do you think now that you've seen her
I
again?
am so proud of you and for persisting, and I'm delighted that you came back and told me it was working well. I'm thrilled. I think that's great.